Every woman, after she gets pregnant, the only intention is to have a... How do we achieve this? You need to do two important things. It reduces pregnancy-induced hypertension. Every woman, after she gets pregnant, the only intention is to have a very comfortable, smooth and less complicated pregnancy and delivery. How do we achieve this? You need to do two important things. One is take care of your diet and your exercise. So the exercise, the benefits of an exercise, it reduces pregnancy-induced hypertension, pregnancy-induced, that is gestational diabetes. It reduces other pain symptoms which occur during the pregnancy and also reduces the rate of C-section and improves the rate of normal deliveries. So the exercises during pregnancy has become a norm and definitely it has to be done. And here in this video we're going to look into some of those. So yoga is an age-old, our Indian ancient practice which is definitely going to help with pregnancy as well. In this video, we're going to look into some of the yoga postures or exercises which can be done right from the 16th week of pregnancy, which will help you in improving your flexibility, reducing your pain symptoms during the pregnancy period, that is low back pain, pelvic girdle pain, and also prevent pedal edema, that is swelling in the foot. So these are simple things which can start from the 16th week of pregnancy, and here is the demonstration.
Today in this video we are going to see few of the yoga asanas that can be practiced by all mothers from their second trimester, that is after 16 weeks of your pregnancy. However, if you have any complications like diabetes or hypertension, please consult your primary care physician and then start the practice. So the first asana today that we are going to do is called as Tadasana, where the complete spine is stretched and all the muscles involved in the spines are stretched in the practice. So keep the foot at shoulder line, which is 1 foot distance, full foot completely on the ground. Interlock your hands completely, slowly place it above the head. Fix your eyes to one single point in front of you where you will not lose your focus and balance. As you inhale, you lift your heel and the hands together and feel the stretch in the complete spine. Hold the posture for about 10 counts or 5 to 6 good breaths, and as you exhale, slowly bring the heel and the hands together down. The second asana that we are going to practice for today is side bending chakrasana. For this, again, the legs will be placed at a comfortable space, usually 1 or 1.5 feet away from the shoulder. Now place the right hand slowly on the hip region. As you inhale, lift the left hand above, slowly stretch up, inhale, try to stretch the hand completely as much as possible. See that your biceps are touching the ears, and through the practice the hands will not be separated from the ears. Now as you exhale, slowly bend to the sides by pushing the hips to the sides. See the other shoulder is not tilted backward or forward. This shoulder should remain straight. Maintain the posture for about 20 counts, and then you inhale and then slowly come back, and as you exhale, slowly drop your hands down. Now this should be practiced on the other side also to maintain balance and gravity on either sides. The third asana that we are going to do is called as a windmill posture, where you need to do it along with a chair or with a couch which is lower than your hip in height. Okay, so for this we are using a chair here. Slowly turn facing the chair. Now place your hands directly on the cushion of the chair, and you see that your shoulder and the wrist is aligned in one line. After that, you try to move your foot a little bit apart from your shoulder and see if your spine is aligned well straight. It is better to practice in front of a mirror to check your position correctly. Now as you are in a comfortable position, inhale and slowly lift the left hand up to shoulder level. Yes, and as you exhale, try to twist, look up your hands and maintain the posture for 5 counts, and exhale and then come back. Now we do the same on the right side as well. This can be repeated for about 10 counts. The fourth one that we are going to see today is for a common problem that every pregnant woman face, that is a pedal edema, that is swelling over the ankle region or sometimes even in the hands and other joints. So this rotations and stretches can be practiced right after the time you get up from the bed, and if you are a working woman sitting in a chair for a completely long time, every 2 hours or 3 hours once in the same sitting posture, you can do the practice at your comfort. So the first one that we are going to do is for the legs. So stretch your legs a little forward. Now we are going to just extend the calf or the ankles nicely forward and backward with gentle breathing. So repeat the forward and backward extension of the ankle for about 20 counts. The second exercise that we are going to do for the ankle is the rotation that has to be done clockwise and also anti-clockwise. Completely rotate your ankle, see that the full movement is established in the legs, and then slowly place it down. And always try to keep a small stool or a chair when you sit and work so that the swelling can be prevented. The second thing is with the hands for the wrist. So you can place your hands forward straight, hold your wrist completely tight, and then now rotate your wrist joints nicely for 20 counts in clockwise direction and anti-clockwise direction. Also the same movements like in the ankles where you open your wrist up and down. The fifth practice that we are going to do today is called as Titli Asana. So we start this posture with sitting on the floor, or you can use a small cushion on the floor to sit if you have a tailbone pain. See that your spine is straight throughout the posture, and here you will maintain normal inhalation and exhalation, which is deep and slow. For that, keep both the feet together and take it as close as possible to the body. Slowly start forward, and as the stretch is becoming comfortable for you, take it closer to the body day by day. Now interlock your hands in front of the toes like this. See that again your spine is aligned well. Now try to flap the thighs nicely up and down. As you flap, focus on bringing the thighs nicely to the ground, touching the floor. As you practice every day, make the stretch very comfortable in the inguinal area as well. Do not take it very high. So this you can practice for about 50 counts a day. The sixth practice that we are going to do today is Janu Shirsasana variation. For this also, your spine will start with straight posture and in sitting. Now place the left leg close to the body and try to stretch the right leg out diagonally at 45-degree angle from your body. Once you have placed your legs at 45 degrees, slowly stretch it over to the sides a little bit more to your extent, bodily extent. Try to place the heel comfortably close to the body. Now you inhale and stretch your opposite hand, that is your left hand up as you inhale, and when you exhale, slowly stretch the right hand out along the leg and try to stretch to the sides. See that your body is in straight line. Do not lean forward like this or don't go backward like this. Align the posture well and try to maintain in this posture for about 10 counts or 4 to 5 good inhalations and exhalations. And when you are about to come back from the practice, you inhale and slowly come back. As you exhale, relax your hands down. The same will be practiced on the opposite side with the right leg bent and the left leg stretched out. The last posture that we are going to see for today in the second trimester practices is Marjari Asana. So for this, you will sit with folded legs on the floor. Slowly stand from your heel for the start of the practice. Place the hands right below the shoulders. See the wrist and shoulder is in one line and in straight line. Now you also will see, look for the alignment of your wrist, knee and foot. Try to keep your foot and heel separated to the distance of the shoulder so that your body is aligned in one line on either sides. Once you are comfortable in the position, now slowly inhale and try to arch the spine nicely down and look up. And as you exhale, try to lift the low back, tilt your pelvis nicely and look down. Again you inhale, slowly up. As you exhale, tilt your pelvis again and look down. So this can be practiced for about 10 counts with good deep breathing, and then slowly come back and relax.